Thembeka Buleni, how's things going on at the moment since the start of level 1? Dr. Buleni?
Things are okay. They're okay.
Is it things have been okay so far? Is the practice picking up? Is it busy?
It's getting more quieter, unfortunately.
Is it quieter towards December as we approach December?
It's December, medical aids are exhausted, people are unemployed. So yeah.
People's priorities are other things nowadays at this time of the year. Shopping for Christmas gifts, Christmas presents, planning some holidays, possible holidays.
If there is any.
Oh yes.
You should keep that in mind.
And Dr. Madimecha, on your side?
All right, good evening, guys. It's actually picking up in contrast to what Dr. Buleni has to attest to. Also because I had to now reinvent my strategies, but I'm grateful. It's a very new and exciting experience with COVID-19 going on at the same time, but it's something that we can actually work on.
Yes, no, I think it's good. I think we are left with no other option but to reinvent our systems, reinvent our practice, come up with more creative ideas on how we can make things work, because we have to make things work. All right, so I see we've got about 183 participants that have joined in. I think we can slowly start the session. So ladies and gentlemen, once again, a very good evening to you all. I hope you guys are doing well. I hope your families are doing well. I hope your practices, your institutions are running smoothly. Hope level 1 is treating you better. And ladies and gentlemen, before I start, I'm just going to just make some announcements. So this evening session is CPD accredited, and towards the end of the session, there is a survey that you will have to answer, or that will pop up. And please answer the survey before you end the session, before leaving the session. Then also we've got some upcoming events. The one is on the 26th, it's the Henry Schein evening, and that's going to be all about digital by Professor Angelo Trodheim, and that's on the 26th of November. On the 24th of November, we've got another session. It's a YDC session where we'll be addressing the final year students, the final year graduates. We'll also be addressing the community service dentists and those that are post-community service year. So stay tuned for those events. Also on the first week of December, we've got a series of webinars coming up. So stay tuned for those. At the end of today's session, we will be taking some questions. So you feel free to ask your questions, and please avoid using the chat option, but rather use the question and answer session. So with not much time that I'm going to speak, I will introduce our guest this evening. And our guest this evening is Dr. Thembeka Buleni, and I'm sure a lot of you maybe have seen her on social media and seen her for a beautiful smile. And her presentation this evening, she'll be discussing practice survival strategies during COVID-19 pandemic and beyond. And this is with Dr. Thembeka Buleni. I'm just going to give a slight background about her. So Dr. Thembeka Buleni is the CEO and founder of Smiles Dental Surgery. She completed a Bachelor of Dental Science degree at the Medical University of South Africa, Medunsa, in 2007, and furthered her studies by gaining her Master's in Business Administration, which is an MBA with the Milpark Business School. She also has a postgraduate diploma in aesthetic dentistry from the University of Pretoria. And if some of you have been watching TV recently, Dr. Buleni is a guest dentist on the new TV show Raak My Mooi, which is reconstructing people's smiles, and was a Health Excellence Award nominee in 2019. Dr. Buleni is extremely passionate about dentistry and the profession, especially making people happy through enhancing their smile, and has her own oral health awareness YouTube channel. So hats off to Dr. Buleni for all your wonderful work and all your passion towards dentistry. And I hand over the platform to you. Thank you, Dr. Buleni.
Okay, thank you, Doc. Good evening, colleagues. Let's wait for the slide to fill the page. There we go. So we'll be talking about the survival skills that you can do to make our practice to survive the pandemic. Like I said, recently, for my side, the practice is slowly getting quiet because people have exhausted their medical aid. But anyways, the whole overview of this is we'll be talking about practice management, talking about marketing, branding, treatment planning, authorizations, dental photography as well. So the role of COVID-19 in our practice, I mean, just like we survived the TB pandemic, HIV and AIDS, swine flu, I mean, we abided by the professionals associations rules. So that's what we're going to do as well with COVID-19. We're just going to abide by the rules and stick to them. That's how we will survive. We've survived such things before. We will really survive the future. It is an opportunity to rebirth. Every time we are faced with a crisis, something new is about to be birthed. So let's learn new things. Let's unlearn the old things. Let's think out of the box. It has a lot of financial implications in our practices. We have to buy more PPEs. We're facing more challenges with the medical aid providers. For those who are not using medical aid, kudos to you. That means we have to buy more equipment, more fogging, disinfecting, sterilizers. You know, we're all aware of that. The thermometers, the sensors for the temperature. We have to go more digital and less stationary because of the COVID-19 transfer as well. We don't want to do that. And if I may say so, welcome to the fourth industrial revolution. We have to be clued up about financial literacy. Most of us in dental schools, we are not taught about practice management. We are not taught about income and expenses. We just really taught to be clinicians, to focus on the tooth itself. But yet most of us end up in private practice somehow. So we need to understand that there is the business parts of dentistry, and which is why we need to understand how we are going to survive during this time. So we need to understand what are your income, what is your expense in the practice, understand what are your liabilities and what are your assets, understand the break-even point of the practice. And if you have not been saving, at least start saving minimum of 5%. You can go up to 20% because a lot of people who were saving around 20% or even more were able to survive the pandemic because practices were closed. So they had to use the reserves from the investment, from the savings, from the practice to run the practice and to make sure that the practice still continues to run smoothly. You need to understand and know how many patients are you seeing daily, weekly, monthly, whether it's new patient or recurring patients. You need to maximize on your cash cow. Your cash cow are the procedures that you do that doesn't cost you so much from your pocket. So if doing smile makeovers is your cash cow, just focus on that. If doing root canal treatment is your cash cow, you focus on that. You focus on what works. Obviously, you need to compare your prices for your materials with the dental companies. Ask for discounts. There's really nothing wrong with that. You have to ask for discounts. Also request for samples as well to try their products. You can get one filling out of that and you can save. You can buy in bulk as well. And also you can request a cash on delivery discount. It can be a 5% or a 2%. that will help you with your finances. You can do your mild renovations in your practices. You can do it yourself, painting here and there, putting new chairs and some decor. And you can learn some basic maintenance, like your chair, your compressor, your suction, learn how to maintain those things yourself without calling the technicians, because sometimes they cost a lot just for traveling. I also found out with my ADEC chair that the light bulb, I used to call Milners all the time. I had a problem. I realized that light bulb is 15 Rand and I can get it from Midas. So I saved a lot. So I learned from that. And then you need to understand your pricing as well. You need to understand that medical aids charge differently, and you also need to put in your price in that column as well. So understand such things. If your practice is taking medical aid, you can take whatever the medical aid gives you, or you can have a fixed price for your practice. Obviously, you have to follow the HPCSA guidelines, and also have a consent with your patients, with your pricing, with your personal pricing. I even made an example there, Dr. 1 and Dr. 2. I'm sure obviously some even can charge even more than that, but this is just an example of the reality that is going on there. So for a doctor who's charging the Dr. 1 and probably seeing the GEMS medical aid patients, meaning the patient will have to pay a balance from their pocket, because the medical aid won't cover everything. They can only cover 317. So these are the things that we need to keep in mind with our pricing in our practices in order for us to be able to survive the pandemic. Obviously, in order for us to continue to survive and strive in this pandemic, PPE is not an option. We cannot risk our life. It's still there. Yes, the numbers are still rising. It's not something you can go about and say, I'm going to leave PPE out of the option. I'll just wear my coat, no longer the gown. We still need to wear the gown. We need to upskill ourselves. I'm grateful to SADA because they've been providing this CPD events ever since lockdown. I mean, we assumed of the webinars. So you can upskill by attending all these webinars. You can do more treatment planning instead of just seeing the patient and just treating the immediate consent and not doing the full treatment for the patient. So when the patient comes in, whether it's for that one consent, you can just do the entire treatment plan and just inform the patient of the thing that they can be done in their teeth, or things that are wrong that can be corrected on their teeth. Digital dentistry, it means it can include more digital stuff, because we are moving away from paper. So you can use your cameras, you can use more scans if you have, but if you don't have, just use what you have. Don't stress yourself, because we're trying to survive here. We're not trying to spend more to order to survive. We're trying to maintain what we have and maximizing on the skills that we have and the equipment that we have for our practices. We obviously still need to market. Marketing these days is mostly digital. Everybody's on their phones. People are using, they're on social media. If you're not a social media person, if you think social media is only Facebook, or WhatsApp or Instagram, and you're not into those things, there's also that advertisement area in the emails, where whether you use your Yahoo or your Gmail, they have a pop-up section on the left where they just advertise. You can even advertise on such things, or even on Google as well. Just if you're, let's say I'm in Witbank, I'll say everybody who was searching for a dentist around Witbank, let Google show my name first. So you have to understand your market. You have to make sure that you market in a way that is comfortable for you as well. Dental education, you need to focus on educating your patients. Sometimes we treat and you don't teach. So we need to go back to the basics, teach our patients oral hygiene instructions, teach them how to take care of their teeth, demonstrate how to brush their teeth, demonstrate how to floss, how to use an interdental brush. All those things, we need to educate them so that they are learned about that. And then we need to build our teams as well, create systems for our practices. Like I said, we are not taught practice management at varsity, so we tend to do things on our own because we've been trained for the past 5 years how to work on your own. You didn't even have the assistant. So when time comes when you have a practice, you have to learn to teach your assistant and your receptionist on the things that you need to do. They need to know and how they need to do their own the things that you want in the practice. So you can create systems around this. You can even write it down and create policy manuals for your practice. Obviously, you need dental protection insurance. Yes, with the upskilling, like I said, Zoom classes, the read more journals, set a study timetable. You can say on Monday, I'm doing PROCEDURE, even if it's just 20 minutes. On Tuesday, it's RESTO. On Thursday, it's digital marketing and social media. On Thursday, it's probably maxillofacial, learn more about removal of wisdom tooth. Whatever that your heart fancies to study more, you have to set time apart, even if it's 20 minutes per day. Set yourself a daily study timetable for that. You can use the free time in the practice to upskill yourself and learn more, and also update your patient's files. Obviously, we all know about the screening. I'm not even going to go through this because you all know about it. I believe everybody's doing everything, and they've done the precautionary measures for their practices because the association has been bombarding us with all of those things. With our dental examination, I'm not going to also dwell on it as well because we all have all those forms where we make sure that our patients fill them. So we need to focus on making sure that the patients fill them thoroughly. And also as a dentist, you also need to fill them thoroughly. The hard tissues, the charting, the period pocket, the bleeding index. Do not overlook small things because they can become big things in the future. I've realized that a lot of patients who come in just for a mere consultation, most of them, they have perio or ortho or some root canal treatment that needs to be done. So if you are not charting the files, if you're not doing a thorough consultation, a thorough exam of your patients and just focusing on the complaint that they come with, then you get into trouble because you're not going to have that patient coming back, and you won't have a good treatment plan for them. You can even go as further as doing the orthodontic treatment charting as well, the molar classification. And the nice thing about also this charting as well, it helps with the smile makeovers. You're not only using it just for ortho, but also when you're doing a smile makeovers, if you're doing the dentures, if you're doing the crowns and the bridge works. And then you have to ask questions that will allow the patients to express themselves. I've realized that most of the time the patients don't even know how to express themselves. But if you give them leading questions, you give them things to say, you probe questions out of them, there's a lot that they can say about their teeth, and there's a lot that you can do to treat as well. Then after everything else, then you can do your diagnosis, and then you do the treatment planning and phase it as well from immediate, intermediate, and long term. And that's how you survive, because you retain an emergency patient that came in just for probably a dental extraction. Now you have a full smile makeover to do on the patient. We have to take pictures. The pictures is for yourself. I've realized that once the patient has left, when you look at the pictures and look at the x-rays that you've taken, there's so much that you can realize that you probably missed while the patient was there. So pictures are not only for the medical aid or for the patient or for marketing only, it's also for you as a clinician as well, to pick up things that you missed while the patient was there, because probably you strained of time and other things that are there. Make sure you diagnose whatever that is there, discuss the treatment options with the patient, allow the patient to interrogate you and ask questions as well. Educate your patient about oral health, taking care of their teeth, teach them how to brush, teach them how to use the floss and all of those things. And then you can authorize for everything. Or if you're not using medical aid, you can just give a full estimation of everything, of everything that needs to be done on the treatment, on the patient. Then you can book the day to do the full mouth. Therefore, you reduce the number of visits. Obviously, with Corona, you want to see less patients in more time. If you can see one patient for a full mouth smile makeover in a day, it's better than seeing 10 patients who just coming in for restorations. Once you've given your patients the treatment plans, follow up on them, because patients have a tendency of collecting quotations. They can collect a quotation from me, Dr. A, and Dr. Z, and then they just compare prices, find out from them if they're coming back for the treatment, and if they're not, find out why are they not coming back, and if something that needs to be fixed in your practice that they didn't like, then you can get a report back from your patients with that as well. So for those who are using the medical aid, the authorization procedure, you need the authorization forms, you need the lab coat if you're doing stuff that needs lab work. You need dental radiographs, you need dental pictures, you need an extra motivation letter on a letterhead, or you can include it in your authorization form. So your authorization form needs to be on your letterhead, you need to have a date, you need to indicate what procedure you are authorizing for. It can be restorations, it can be root canal treatment, it can be orthodontic treatment, it can be implants, patient's details, medical aid details, and main members details. You need to include the procedure codes, the ICD-10 code, the tooth numbers, and the amount. Like I said, you can decide whether you put the medical aid rate amount or your own amount there. And you can add in a motivation there, or you can have it in a complete separate form. Then you can just write the full motivation for the medical aid. Well, with dental photography, use what you have. You don't have to buy fancy equipment. You are trying to survive here. We're not trying to be fancy. But if you have a Nikon or a Canon, whatever a professional camera, use that. And if you are comfortable with it, use it. But if you are not, the smartphones are so smart these days. They take beautiful pictures, whether it's an Android or an Apple. I mean, there's another debate, but they take pictures at the end of the day. That's all you need. You need pictures for your treatment plan. You need pictures for case acceptance of your patients. Like I said, choose the weapon of choice. It's up to you. Choose what is more comfortable. So the essentials that you need to take good photographs with your camera, with your phone. I'm going to focus on the phones, whether it's Android or Apple, it's the same thing. You need a camera of choice. You need good lighting. You need good posture and positioning. We're going to discuss that later. The perspective, what do you want to see with the picture that you're taking? You need to understand what is the picture for, the depth of field, the exposure, and you definitely need the mirrors and the retractors. So those are the essentials. That ring light, you can get it online for 30 rands that you can put on your phone just to bring the extra light on your phone. You definitely need the cheek retractors, deep retractors, and the intraoral mirrors. So this is my stuff. That's why I didn't cover their eyes. They agreed to take those pictures for me. So for the full front view, if you're using your phone, you need to make sure that the phone is parallel to the face of the patient. The side view is the same thing as well. Make sure the phone is parallel to the patient's face, and you focus on the neck up with the patient as the picture shows. So when you're using an Android phone, you need to position yourself in a 12 o'clock position and be able to take the smile position. But if you're using an Apple phone, you need to stand in an 8 o'clock position. You can see that we're using the light with this one with an Apple phone. With an occlusal view, different positioning as well. Android must be on the side of the patient. With a Apple phone, you need to be in a 12 o'clock position to be able to take that good occlusal view of the mouth. With an Android phone, when you're taking the mandibular, you need to be on the 8 o'clock position, be able to hold the mirror as well and angulate your phone to be able to take the pictures. With the Apple phone, you need to make sure that it's similar position, but make sure that your light is able to direct into the mouth. The reason why we're using the ring light for the Apple phone is that when we're taking the pictures with an Android phone, you can go to settings and you can always go to the flashlight, press always on, when you're there with the Android phone, you can always take pictures without having the flashlight flashing because it's gonna stay always on. But with an Apple phone, it does not allow to have the flashlight always on. So you can use a flashlight, like a ring light, like I'm using on these pictures. So that's how you position your patient for the retracted view, the lateral view as well. And you can ask the patient to hold the retractor to be able to take nice pictures. You can see the difference as well on how you handle your phone with the lateral view of the left side as well. So both the cameras, both the phones, they take good pictures, but they're different quality. But for now, it's only for recording. You need it for records. You need it to be to diagnose. Once you get comfortable with your phone taking pictures, then you can move to a professional camera. But at least you are doing something with what you have. And then you can collage your pictures. We know how to collage the pictures. And then the pictures, you can use them for marketing. You can take the before and after pictures and send them to your patients. So you send them via WhatsApp or via emails. That is just part of the marketing as well that you can do for your practice. So marketing, like I said, you market according to your market. Don't wink in the dark and don't just open the practice and stay there and think people know. Let them know that you are there. Let them know what you're doing. And if your patients are not, if you're in an area whereby patients are not, they don't have the cell phones, you can use the newspapers. You can even market in your local market, supermarket as well. I've realized that if for example, I'm in the Duke rural of KwaZulu-Natal and people don't have the smartphones or the data to be able to go on social media to see my post, I can talk to Boxer Superstore or ShopRite there and make a poster there to be placed in their notice board, because every supermarket has a notice board. You find your way to market to your patients. You know your target market. You educate your patients. Like I've been saying that Google reviews, you can ask your patients to rate your practice. If you're not on Google, if your practice is not found on Google, you need to go back and make sure your practice is visible on Google. When people type your name, your practice can be seen on Google, and you can request your patients, especially those ones who are always pleased and who are happy about your treatment and the work that you've done, and they're extremely happy. Always ask them to give you a review. That's how you're gonna get your Google rating to be up on Google. Like I said, take your before and after pictures and send them to your patients. Do some in-house marketing, send SMSs, send emails to your current patients. Treat them well. That is the cheapest marketing ever. Treat your patients well. Treat your patient that you see every single day. That first patient that you see them as if it's your last patient of the day. The midday patient, each and every patient, give them the attention that they are the only patient that you have in your practice. That is your marketing. That is the free marketing that you can do. And with that marketing, it gives more word of mouth, because people go out and they talk about the attention that you give to them, the time that you give to them. You're not rushing to look into their teeth. You talk to them. Patients like them, like that. They like to be listened to. They like to be paid attention to. Give that to your patients. That is your marketing, and that is your branding as well. Email your patients, like I said, and send them WhatsApp. We can also do the virtual consultation now. It is no longer a taboo to make a consultation via Skype or Zoom or WhatsApp or phone call. It helps you to build a rapport with your patient, because you can be able to consult or talk to your patient in an environment whereby they're probably at home or in their car. They are comfortable. They're not in your practice. They're not seeing all the equipment. They're not threatened by all the light and just the atmosphere of being in the dental practice. So they are free to talk whatever issues that they have, and they can build a relationship with you. And by the time they come to your practice, they have that calmness within them, because they've built that relationship with you outside of the practice. They feel like they know you on a personal basis, even if they don't know you, but that's how people feel. And it always works. So you can start this with your existing patients. Be available for them. Obviously, you need to set boundaries. They can't call you at night now with video calling now. Set boundaries as well. So you can do it for free as a startup, or you can charge. But at this time, if you can do it for free and then give them a discount, just say, okay, since you've consulted, if you come for an actual consultation or actually the treatment you are consulting about, let's say they were consulting about a crown, probably when they come, you're going to give them a 5% discount because they consulted via the virtual consult. So that is your way of drawing them in your practice to make sure that they come to you. And most of the time they do come because they've already have that relationship with you and they are comfortable with you. Well, we need to guide our mental health and our psychological health. We are so obsessed about the COVID-19, people dying, families dying, employees dying. I succumb to that. And it's not a nice thing. So we need to take check of our mental health as well and our psychological health as well. We need to take our time out. Social media is bombarded with a lot of information, which is good and bad at the same time, but you need to control yourself. Like I said, set boundaries for yourself, block the TV, block the kids, lock them off your bedroom, take a day off, take time off for yourself to be able to recuperate, take time to pray, take time to meditate, take time to affirm yourself. I mean, like I said, as health professionals, we've survived TB, we've survived AIDS, we've survived listeriosis. So there was no meat on the shelf. We survived that. I mean, you can survive COVID-19. That is part of the affirmation that you need to say to yourself. A lot of practices all around the countries, they went bankrupt, but there's few, if there is any, of the practices in South Africa that really went bankrupt. So those are the things that you need to be grateful for. Part of your prayer, you need to be grateful for the fact that you haven't even had COVID-19, or if you had contracted COVID-19, but you were able to get over it and you are healthy. Just be grateful that you still have your staff members. Be grateful that you still have your patients that are coming in. Just meditate and take time to be still and meditate on all the goodness that is happening around you. Just focus on the good things that are happening in our lives. Breathing exercises, that would help as well. If it means you need to exercise to help with the breathing exercises, do that as well. Avoid negative people or situations. And I'm sure for some people they're like, oh, thank God COVID did that for us because we avoided a lot of people and you're going to blame it on the COVID-19. Avoid stressful conditions or cases. There are some cases that when you look at them, you realize that this one is going to give me stress and I do not want to do it. Then don't do it. Guide your mind, guide your heart, guide your mental health, guide your social psychological health. You don't have to do everything. Like I said, focus on your cash cow. If your practice is good in this particular procedure, just focus on this and excel in it. Everybody who's looking for that will just come to you. In that manner, you remove all these excess things that are going to give you stress. Spend more time doing things that give you peace, the cases that give you peace, the cases that give you the enjoyment and the smile at the end of the day. Physical health, you can get a microscope, but you don't have to. You can use the loops instead, but you need to be able, even if you can't get the loops, just get the glasses if you feel like your eyesight is really getting out of sight to make sure it's in sight again. Get some rotary instruments if you are doing root canal treatment. You don't need to exercise your fingers to do the root canal treatment. Get those equipment. Get them. You don't have to buy them cash. You can get them on a payment option from the sellers, from the dental companies. You have to negotiate. Like I said, you don't have to just take things as they are. Negotiate. Find out if you can pay this off over 12 months, 36 months, 24 months, 72 months, in order to afford you time to be able to pay them off and reduce the stress. So you have to do things that help you to reduce stress, but also improve the practice, improve yourself, improve your lifestyle, and improve the practice as well. Get some monthly back and neck massages, because as dentists, we work mostly with this area of our bodies. So we need to cater to that and make sure you get the back and neck massages. It's not a luxury, it's a necessity for a dentist to have this. Exercise, obviously. Get a physiotherapist to help to give you the exercises that are good for your body, that will also assist you with the current conditions that you have. If you have a back issue, obviously they'll give you proper exercises to do that as well. You don't need to strain yourself. Healthy diet. I mean, as dentists, we are more focused about oral health, hygiene, how to brush your teeth, and also we teach patients the diet, but we don't do that for ourselves. This is not only for the teeth. The healthy diet is not only to keep the mouth fresh and clean and have a wide smile or a Hollywood smile. It is also for the full body as well. A healthy body as well. You need to be healthy as well in order to have a healthy practice and a healthy physique and a healthy life as well. So we need to go back to eating healthy. I mean, we've been avoiding dietitians, but I think it's time that we go back to our dietitians and get our diet on check. I believe that the COVID-19 testing is going to form part of our yearly health medical checkups that you do when you do for cholesterol and high blood pressure and diabetes that you do yearly. So now I think this is going to be part of it. And I think it's a good practice that you do it, not only for yourself, but also for your staff as well. I spoke about systematization. So you need to create systems for your practice. By creating systems, you remove the workload from yourself. You give it to your staff members. Create a good team, build your team. The team of the practice is as good or is as strong as the owner. Have weekly or monthly meetings and create some incentives according to your practice. So by branding, you must have a mission. Why are you in dentistry? Why are you even a dentist in the first place? Probably you don't even like dentistry. Maybe you are supposed to be something else, or probably you're not even supposed to be in private practice. You need to understand what is your mission on earth, not only in dentistry, on earth. What were you brought on earth for? Probably you just studied by mistake dentistry and you find yourself feeling like, oh, it's quite nice, it's enjoyable, but really you are not a dentist at heart. So COVID-19 gave us time to really look at the things that we really want and the things that are making us happy and the things that we should get rid of. So find your mission as well. Probably in private practice, but you're supposed to be serving at SADA, at the office. Maybe you're an office person, even though you're a dentist. So those are the things you need to look into. Have a vision. What is your practice going to look like in the next month, 3 months, 6 months, a year, 5 years, 10 years, 20 years, 50 years, if you are still young and you still want to practice for the next 50 years. And then you create goals for your practice to reach the vision that you have for your practice. Have objectives, be strategic with your objectives. With the objectives, you can say, in the practice, this is what my staff, I want them to do in order for me to have that vision of, let's say, Vision 2020. By the year 2020, the practice should be like this. You narrow these things into small chunks, biteable chunks that you can do for your practice. And then what are your values? Your values determine who you are. What do you value? Do you value certain things? I'm not gonna go there. Have a slogan for your practice. My slogan practice, I see the time, that's why I'm rushing. The slogan is, we put a smile on your teeth. So we make sure that people's teeth smile after we're done with our practice. And branding doesn't mean that you need to branding of the practice. The brand is you. You are the practice. Remember, the mission is linked to the brand. So by knowing your mission, you know the brand, you know what you represent in life, you know what you represent in your practice. So when they talk about branding, they're talking about you. What are your values? What are the things that you value? What are the things that make sense to you? What are the things that you bring to the world? What are the things that the world is going to miss once you pass on this earth? That is branding. Oh, well, when you create a policy manual, like I said, systems have great teams. How do you do that? You create a manual. With your manual, you explain every single thing that you want your staff to have. This is an example of mine. You can see that on Annex B, I'm talking about mine. Obviously, you have to have the disciplinary codes, get them from Department of Labor. With your receptionist, they need to know what is their purpose in the practice, what are their duties. Teach them the telephone etiquette that you want them to master for your practice. How to handle the phone calls, how to transition from the phone calls, what to say, how to welcome their patient, your patients. Actually, it's their patients because it's the practice. Everybody's involved. Give them their daily routine. What do they need to make sure, but throughout the day, they are able to cover their weekly routine, their monthly routine. How do they book theater patients? What is their morning routine? What is their routine at the end of the day? All those things you teach your receptionist. So you say this once, you give them the manual, they go through them, they study it. This is what franchising come in, because people go through this, they read it, you find it, the franchise in Johannesburg, they speak the same way as the franchise in KZN, for an example. They know everything in a sequence. So this is what you do as well for your practice. Franchise your practice. Also with your pricing, whoever's doing the claims, they need to know the proper pricing. Same thing with the dental assistant as well. They need to know what is their job, what is their mission, what is their what they need to do for the practice, their weekly routine, their monthly routine, what do they need to do for the practice? How do they sit the patient in the chair? How do they talk to the patient? How do they handle the needles? Yes, they are being taught these things at school, but in your practice, there's a particular way that you want to do things. How do they do all of these things in the practice? It's the same thing for you as well. As the time goes on, you'll have this engraved in you, you'll be just doing it effortlessly. What do you do at the beginning of the day, before the treatment, after the treatment? What is your your daily routine, your weekly routine? With time, it will be embodied in you. And the nice thing about having this for yourself as well is that when you hire an associate dentist, you can give them the same policy to go through so that they can learn how to do things the way that you want them in the practice, so that patients can say, oh, this doctor does the same thing as Dr. Buleni, for an example, if he's my associate dentist. You cannot tell the difference because that's what you want to happen. Same thing with your cleaners as well, their routines as well. What do they need to do? What is required of them? They need to know that. So with the policy as well, you need to understand what type of dental business remuneration you're going to do for your business. Normally, a lot of people just do the salary, but with the COVID-19 coming into place, there's a lot of fee structures that came into place. You can play around them in a safe manner that's gonna profit you and the practice and everybody, and make sure everybody in the practice is safe, because some people paid the salaries, but they're not happy because they took from their own pocket to pay their staff. Probably you can have the salary with incentives, but you have to explain and make sure that those incentives are earned and not cooked. And or is your practice only incentives? By only incentives, you can just say in whatever the turnover of the practice, the receptionist, they get 3%, or the receptionist, the dentist, the receptionist, the dental assistant, they get 3% of that. I mean, you can play around with that to make sure that at the end of the day, it's a win-win situation for the entire practice. So for the incentives, it can be patient-based, it can be turnover-based, it can be a combination of patient and turnover. It can be treatment plan accepted or paid, or it can be a small makeovers that were accepted by the patients. you know, those are the incentives that you can put. There can be more, and there can be some that I don't even know about, but this is the idea. These are the things that you can do. These are the things that I have done as well. So you need to understand if you are a clinician or an entrepreneur. A clinician is just a mere dentist who does things, everything themselves. They are salary based. As long as they get their salary, they don't care. Without them, the business suffer. They suffer. An entrepreneur sees that they think they're entrepreneurs, but they're not, because the business, without them, the business suffers. They have this mentality that no one is better than me. They're just comfortable like that. But if you're an entrepreneur or a business person, you delegate, you hire the best staff, you hire specialists to do certain jobs for you, you delegate some of the stuff, you refer some of the work that you don't want to give you a headache because you want to have a peace of mind. You are profit focused. Your business continues whether you are there or not, because you have a policy in place, and you have policy or a franchise kind of business in place. And you're comfortable being uncomfortable about this whole thing of COVID and your business being run by other people other than you. But because you trust that your processes and the policies that you've put down, people are following them, and you've gone through them with everybody else, you are sure that the practice will go well. A lot of people succumbed to their renting as well with the COVID-19. A lot of malls were closed. The practices that were in a mall, they were closed. So a lot of people were closed up until level 3, 2, when the malls were opening. So a lot of people lost a lot of income based on that. So now it's time for you to go back and discount and request a COVID-19 discount. Or you can think about the fact that you need to move to cheaper offices because the rent is high and the business is not so well like before the COVID-19. We can think green, think solar. You can think of buying commercial properties, but it's quite expensive. The better option is buying a residential property, rezone it, and move your practice there. In that way, should we have another lockdown, you are able to work because the practice is yours, the house is yours, there's no restrictions of the malls. You can work and do the emergencies in your practice, in your house. In summary, let's be safe. Let's equip ourselves with financial management, practice management, financial literature, not only on how to make the greatest anatomy, the occlusion is perfect, you have this perfect smile line, but also financial literature. We need to be clued up with such things. In your Zoom classes that you are attending, I hope you add in anything that includes practice management, financial literature, financial management, in order for you to be able to be clued up. You just need the basics and focus on that and excel on the basics. We need to think about creating the company manuals or the policy manual for the practice. Don't allow yourself to be saying things over and over again until you get a headache. Just say it once and then give them the manual. Whenever they want to ask you something, just refer them to the policy manual that you've created for your staff. Upskill yourself. Like I said, as much as we are focusing on the clinical stuff, let's also focus on practice management. We need to market ourselves, market according to your market. You know your market, go back to that. What was working, continue with that, because it is what has made your practice to be where it is right now. Dental protection, whether it's PPE, whether it's the dental insurance cover, you need to protect yourself. You need to protect yourself from the negative situations. You need to protect yourself from the stress. You need to protect yourself from the negative issues that are going to affect your profession and yourself. I'm grateful for this opportunity. Thank you for listening to me. I hope I added value to your life. You can contact me there if you can, or if you want, or on my social media platforms. That's where I am at. Thank you.
Thank you so much, Dr. Buleni. That was a wonderful presentation. I really admired the way that you brought in all the aspects under one umbrella and presented that to us. Dr. Madimecha, who's our YDC representative here as well, would you like to give some of your comments to Dr. Buleni? What did you take from this evening's presentation?
All right. Good evening, guys. The presentation it was very fully loaded. It had bits and aspects of everything, and I would like to believe that Dr. Buleni actually deserved a whole day to actually really unpack everything she had in the package, because she spoke a whole mouthful, but she could have gone a bit more on a couple of things. I believe clinician versus entrepreneur is a topic on its own, and visual dental consultations are a topic on their own. And it's a very fully loaded presentation, and I believe the YDC and SADA as a whole really did a lot to pick the right person for the job this evening. But I also believe that it actually shows the amount of adjustments we have to make in our practices to make things happen. Because at the end of the day, we are clinicians, but we also need that remuneration so that we actually feel good about ourselves. So she really went a very big step. And I believe this evening we really have to adjust our strategies based on the advices she gave. It's a very wow presentation, and I believe that most of us would actually sit down and start replanning. And in light of the present pandemic, I believe that we might have to readjust our strategies as well, because now after this, we might get the introduction of the NHI, which for dentistry is a bit vague, but we'll have to adjust according to whatever we get from it. And from the presentation, it's a very loaded presentation, and we are very grateful to Dr. Buleni because she unpacked everything. And I believe the YDC can see that now she has touched also on other parts that might need to be presented on their own. And wow, now I as a person and also as a clinician, I'm gonna have to sit down tonight this evening and think about how I can improve my practice as a person. But it's a very good presentation, and I'm very grateful to Dr. Buleni and also to SADA for this wonderful presentation.
Thank you, Dr. Madimecha. Thank you for those comments and also recommendations. I think going forward, we can look into those areas that need expansion. But thank you once again. Dr. Buleni, we've got some questions. I would just like to say that some of the questions, we won't be able to take all the questions. I'll just run through some of the questions, and then others, which I think are more related to community service and locum dentistry and that, I think maybe we can try and address some of those questions on our event that we're having on the 24th. So I'm just going to run through some of the questions and so that you can answer them. The first question says, how would I know what my more profitable procedures are?
Oh, okay. So you can check for this week, it's Thursday already. Just go back to your diary, check on all the patients that you've seen. The most procedures that you have done are mostly your most profitable procedures. So you just take those and then you focus on that.
All right, yeah. Thank you. Another question says, you say authorize everything, but it doesn't seem to be a guarantee for payment. If you'd like to expand on that.
Yes, I said authorize. If they can remember, there is a part where I showed different medical aids how they pay, and that you need to have your own fees as well. So by authorizing, it helps the patients to see that these are your fees and what the medical aid can cover. From that, get the response from the medical aid. They'll tell you how much they are willing to pay, and the balance that will need to be paid by the patient. And then that's where the consent comes in, and then you have a dialogue with your patient. You show them the response from the medical aid that you've authorized for everything. Your medical aid says they'll pay for A, but they won't pay for C. They'll pay for D, but they won't pay for E. So that's when you come in as a patient that you have to pay the balance of whatever the medical aid is paying. And the patients are aware that the medical aids don't pay everything. And they're even aware that there is also an insurance that is called a gap cover. A gap cover is an insurance that covers everything else that the medical aid didn't pay initially. So you'll find that the patient has a normal medical aid and also a gap cover. So whatever that has not been paid by the medical aid, they'll push it to the gap cover, or they'll pay it themselves cash. So you can discuss how they pay that balance. It's either they pay before the treatment, and on the day of treatment, you make sure that everything has been paid. Or if you want to treat the patient, then you pay, and they pay afterwards, which they never do, and you are stuck with an outstanding amount of money that the patient hasn't paid. You can do that, but you decide what you want to do for your practice. Authorization does not guarantee full payment. It's just an authorization.
Thank you. The next question is, most of the DSP networks don't want to pay for photos or pictures and no more than 2 X-rays. How can I plan properly without that?
You discuss that with your patients. With the pictures, since you'll be using your phones, you can just be taking them for free initially. And with time, once you get to take good pictures, good quality pictures, then you can start charging for them. You can inform the patients, just like the authorization, that your medical aid only, for an example, the gloves and mask, they only cover 8109 times 1, which means 1 glove, meaning the left hand, they say you decide what you do, whether you put the glove on or not. So you need to make sure that you as the patient cover whatever the medical aid does not pay.
Okay. Because I think maybe you sum it up, because there's another question here that says, medical aids never accepted pictures from my smartphone and they do not want to pay for any aesthetic treatment.
Obviously, aesthetic treatments, they are the same as it's cosmetic. Any cosmetic stuff, the medical aid does not cover. It's part of their exclusion completely. However, some patients believe that doctors don't want to use their medical aid. So I continue to authorize, even though I know that the medical aid would not approve even 1 code, so that I can give the patient the peace of mind, because sometimes they feel like I do not want to do my job. So I do the full quotation and the authorization. I send to the medical aid, they decline, come back, and then I show the patient, and then they make plans to pay for that.
Okay. Another question says, how do I handle my situation where I have to remove a wisdom tooth, but my patients can't even afford a Panorex radiograph?
They pay cash. You tell them the important, that's when dental education comes in. You explain to them why you really need to have that panoramic radiograph. Make them understand why you need them. It's not for fun. It's not for adding the funds. It's about their health as well. You need to know where the tooth is positioned. Are there any vital signs close to that? It's their life, their health at risk as well. So you want to go in there knowing what you expect, so that you can plan accordingly. Because if you fail to plan, you've planned to fail. So as a clinician, I don't plan to fail. So I want to prepare accordingly, not only for me, also for you as a patient. I want the best for you.
Thank you for that. The next question is, have you ever encountered a situation of identity theft, only to find out later that the patient you've treated was a case of stolen identity?
I did. It was twins. It was a funny issue. It was this year. So this twin came for a clean. So the staff didn't recognize. So when the patient came in, luckily I had those pictures. So with the twins, I have twins as well. So it's easy to identify twins, even though they can fool a lot of people. So you're looking at the picture, you're looking at the charting, You're looking at the patient's mouth. You're like, nah, dude, what's your name? So that's how I was able to bust the patient. And then I told them that, you know what, I have cameras in the practice. So you have frauded me. You give me my money and I won't report you to the patient, to the medical aid. Or if you don't pay me, I report you to the medical aid that you are defrauding them using your sister's medical aid. I got my money and we canceled it.
What's the intention, a fraudulent intention of those twins, if I may ask?
Yeah, she knew that she's not on the medical aid. And she knew that it will not pick up because they are twins, they look alike. So she used the opportunity and she apologized.
Wow.
She did. Yeah, it happens.
Sure. Because at first I thought that question was a bit silly, but I mean, look at that it does happen.
It does happen. It does happen.
The next question we have is, don't you sometimes feel that you're actually working for the dental lab in cases where there is high lab demand from your patients?
I used to feel like that until I realized that they are also a business. They are charging what they are worth. So if the medical aid quotation comes with let's say it's 4,000 Rand, and the medical aid is willing to pay 1.5, that's where I have to put in my own prices. So I was not aware that I can put in my own prices. I thought that as a dentist, I need to accept whatever the medical aid is giving me. Until I was aware that, no, I need to put in my own prices. So I can put in my own prices and the lab can charge their own prices. So if I do a smile makeover, a crown, when I give the quotation to the lab, to the patient, I show the lab fee and I also show my fee. So it's up to you to adjust your fees so that you don't feel like you are working for the lab. Or if you feel like your lab is just too expensive, find them more reasonable. It's either you talk to them, let them know that they are too expensive, communicate with them, and hear their response. If you're not finding the common ground, search for another lab. But still, if you're not finding what you're looking for, I think fixing your prices would be best, where you say your crown is for your fees are 4,000 Rand for a crown. I'm making an example. Or let's say your fees is 2,000 Rand for the crown, and the lab fee is 2,000 Rand. When you merge, it's 4,000. When you present to the patient, you say the crown is 4,000 Rand. However, in that 4,000 Rand, 2,000 is yours, 2,000 is for the lab. In that manner, you won't feel like you are working for the lab.
I see. Okay. The next question is, what are the legal requirements for franchising one's practice in terms of HPCSA, CMS, medical aid schemes, practice numbers, etc.?
That's a whole day of lecture.
Maybe just in a nutshell, if you can explain.
In a nutshell, in order to franchise, you need to, most of the practitioners, they practice as sole proprietors. So now if you want to franchise, you need to move from being a sole proprietor and be an incorporated or a PTY LTD. Obviously, you need to inform the HPCSA. With the medical schemes, you inform them as well. With the practice numbers, you can have one practice numbers in your different practices, or you can have different practice numbers with the different company names. Let's say I have Smiles Dental Surgery in Witbank. Maybe I've got Smiles & Co. in Johannesburg. Everything is still under Dr. Buleni, but the company's names and the practice numbers are different.
Okay. I've got two questions that maybe I want to tie up in one. It says, just wait, does Dr. Buleni mostly treat medical aid patients? And then there was another question about your thoughts on a cash-based practice. Maybe you can tie those two.
My thoughts on cash-based practice, excellent. You deal with the two, the patient pays you, they leave. That is ideal. That is ideal. Just like when you go into the shops, you buy, you pay, you leave. With the medical aids, it's cumbersome because there's a lot of systems you need to put into place. You have to have a lady who does the claims, the lady who's going to follow up on the patient. You know, there's a lot of things and a lot of work and paper trail that is needed there. So where I'm situated, most of the patients have medical aid. So I treat mostly medical aid, but I have my own prices. So whatever that is left from the medical aid that is not paid, the patient needs to pay for it themselves. And obviously my payment agreement is that you prepay me. So on the day of treatment, you've already paid for the treatment that you're doing. The only treatment that are allowed to lapse to go for up to 18 months is the orthodontic treatment, because we are still doing the braces in those 18 months. So you can pay every month. But in terms of a smile makeovers or crowns or a restoration or an extraction, by the time I'm done with the treatment, I need my money. It's an exchange.
All right. Yeah. Another question that says, how much time do you set aside for a full consultation?
It can take up to 30 minutes to 45 minutes, you know, taking the pictures, taking all the radiographs, the charting. It can take up to 45 minutes. And also remember, if you're doing these things, you're talking to the patients. You know, some quite tend to talk a lot. So you have to listen, because you're building rapport. You need to understand the patient, their views, their background, because most of the patients, when they come in, they tell you one thing: I hate dentists. So you need to make them buy into your practice as well. So more than being a clinician, you are also salespeople. You need to sell your practice. You need to sell yourself as well in the business. So that takes time.
The next question that says, gap cover is not really all that available for dentistry. I'm not sure if that's a comment or if it's a question.
I think it depends on the insurance cover, as we have different insurances, just like the medical aid. Some medical aids, they'll cover, let's say, the dental pictures. Some medical aids will cover. So you need to find out which gap cover will cover for the dentist.
Oh, okay, I see. I think I'm going to do a last question here. I feel if you have more questions for Dr. Buleni, her email address is there. I'm sure she'll be more than willing to answer your questions via the email when she gets a chance. I see there's also a lot of questions regarding regulations for medical aids and that. I just feel that maybe the right platform is maybe to get in touch with the SADA head office. Maybe if you give them a call, or visit the website, or drop them a message on the website, I think they'll be more than willing to assist you on that, with that regard. I think this is the last question. Can a dental practice function without charging VAT?
Everything is VAT charged, including the bread, including electricity.
That's true. All right, Dr. Buleni, I think we're going to end our session over there. Thank you very much for joining us this evening. Thank you for supporting the YDC in this regard. I think the young dentists of South Africa have a lot to take from this presentation, and going forward, you know, there is no such thing as, you know, post-COVID. I think it's the new norm with COVID. So I think based on our current situation, based on what has happened this year, I think we just have to build ourselves, gather our strength and move forward, you know, picking up pieces of hope and creativity and ideas, learning from one another, engaging with one another, keeping ourselves up to date, you know, learning all the time, attending webinars, reading journals, you know, attending online courses. And I think that's the best way we can go forward. And thank you once again. And I hope to see you again, and hope for you to join us again in our future endeavors with the YDC. Also, just another thank you to Dr. Lamola Madimecha, who practices in Limpopo province. in Polokwane. Thank you so much for joining us this evening. And ladies and gentlemen, have a good evening, and all the best for the festive season that's ahead. If you guys are traveling, travel safe. If your children or your family, if the kids at matric are busy with exams, I wish you all the best. And yeah, support them, keep them motivated. If your kids are at university, keep them motivated. As also Dr. Buleni mentioned, that, you know, mental health is a very important aspect. And I think this year especially, it has taken a toll on us. So I think just keep all those factors in mind, spend a lot of time with our family, do things that, you know, reset your body, reset your mind. And yeah, all the best with any endeavors that you're about to take. So on that note, thank you, ladies and gentlemen, and good night.